This is Altura Now with Steve Iloff.
Thanks for joining us. Information about the COVID-19 crisis is evolving every day. Joining me to discuss the situation in the nursing home sector is Tadhg Daly, Chief Executive at Nursing Homes Ireland. Tadhg, thanks for joining us.
You're very welcome.
It's a challenging time for everyone at the moment. Can you give us an overview of the current situation in Ireland with regards to COVID-19 and the nursing home sector?
Yeah, well, it's very challenging. This obviously is a very significant worldwide pandemic. We in Nursing Homes Ireland have been preparing since the end of January at this point in time, and we introduced visitor restrictions on the 6th of March. But at this point in time, we now know in Ireland there are 86 clusters of the COVID-19 virus within nursing home sector. So that's proving very challenging for our staff and obviously for the residents we look after and their families. The issues for us primarily are around staffing, access to equipment, and the whole area of testing and testing results. We have been engaged with the Department of Health and indeed the HSE for a number of weeks, but we are a little bit concerned that the prioritisation required for the nursing home sector wasn't at the level it should have been. However, we have in recent days been engaged proactively with the Minister and others, and we are confident now with those measures ramped up, we will be in a much better position.
And how important is it that we ensure that with all of the restrictions in place, that when providing care, we don't leave anyone behind?
Yeah, well, I mean, that was the point the Minister made in his speech following the government announcement on Saturday last, to leave no one behind. And that is vital. We in the nursing home sector, and particularly the staff in our member nursing homes, are very professional people. They're very caring, very committed. They're part of the community in a nursing home. They know the residents intimately. They care for them 24/7, 365. So we're well placed to be able to look after those residents. And as you say, it is absolutely vital that we leave no one behind. And there has been some debate around the age profile of residents. But in my mind, it is important that age is not a predicator on the basis of either treatment or indeed clinical decisions at this point in time.
And let's talk about the frontline issues. There's a raft of protection measures that staff need to follow in nursing homes. You've mentioned a few of them, but could you run us through the most important ones?
Yeah, well, I suppose, again, the nursing home sector is at somewhat of an advantage in respect of viruses generally. On an annual basis, the nursing home sector would deal with winter flu or indeed an outbreak of the winter vomiting bug, for example. So the infection control procedures would be very, very high in the nursing home sector. Indeed, I just checked recently, our regulator in their last overview report said there was 82% compliance with infection control. So that's a good indicator, if you like, of how prepared the sector is. The other benefit in respect of the private and voluntary sector is the vast majority would be single ensuite rooms. So that's obviously very important from the area of isolation. But yes, the measures that are being undertaken are, I suppose, enhancing the measures that would be considered in normal times. But we're not obviously in normal times given the challenges. So what we've seen recently is obviously the ramping up of our infection control procedures, but equally from the point of view of staff. Our members, again, in the last number of weeks would have been taking staff temperatures on a regular basis. Members would have been preparing, looking at maybe a wing of the nursing home that could be used for an isolation unit, for example, or maybe indeed even leaving some rooms vacant, pending the requirement for rooms at the end of a corridor or whatever. So very practical and pragmatic measures being taken by the sector. And, the private sector is very agile in that regard.
And so if organisations want to implement additional protection measures, what sort of things do they need to consider?
Well, primarily it's around the area of, I suppose, the agility of the private sector to do things. And as I said, maybe to reduce capacity. In some cases, I'm aware where people use maybe a side entrance of a nursing home so that a particular wing might become the area where maybe COVID residents or indeed staff would use. So it's about, I suppose, being creative and innovative around the care of the older person. We have a long track record in many countries and indeed Ireland of looking after older people. So it is important that we, while there are very, very important challenges, that we also think about some of, as I said, the creative and innovative ways that we can try and stem the tide.
Every country around the world is experiencing logistical and supply chain issues. What steps are being taken to ensure supply of PPE and other items?
Yeah, I mean, that's a huge challenge. And as you said, it's a worldwide challenge at this point in time. It's, pure supply and demand. To be fair, the HSE and our government have invested heavily in that, in securing PPE from China. But our members have been out there in advance of that, trying to secure their own PPE. One of the challenges that we have seen, and it's replicated in other countries from speaking with colleagues across the nursing home sector, is that very many of the suppliers are now targeting their resources towards the HSE or the NHS or the national effort. And sometimes the nursing home sector, or indeed the care home sector for that matter, or the care at home are left behind. So members are again sourcing their own to ensure that they have a supply for a day or two. But obviously we now have a commitment from government and from the minister that the supplies required will be provided, and that it will be provided on the basis of need and not on the basis of private versus public, or indeed acute hospital versus care in the community.
And what about other things in the supply chain as well? What can organisations do? How creative can they be to secure their own supply chain?
Yeah, well, I mean, in fairness, the Irish community have rallied around the nursing home sector over the last week. I've been speaking with a lot of schools, for example, schools that may have PPE in their laboratories or in their workshops with the schools, and they're making that available. A number of companies have donated product to the nursing home sector. And indeed, people are, in some cases, making their own face masks, obviously following WHO guidelines. So again, the ingenuity of people when faced with a crisis never ceases to amaze me. And that's something we need to hold on to and hold tight on, is that while it is challenging, we will prevail and we can overcome and ensure, as you said earlier, that no one gets left behind.
And it is incredible, isn't it, how resilient we can be as a community and how we can adapt. And even it seems like the public are entering into this difficult time with reasonable humour. They're taking their responsibilities seriously and are generally following the instructions from the government.
Yeah, hugely. And again, we've had 2 weeks now of restriction of movement in Ireland. That has been very challenging. The Irish, if you know, are a gregarious nature and like a party and like to meet people. But obviously in this current environment, it is important that we would follow government advices and WHO advices. But again, with a sense of humour as well. We've seen fantastic videos online from members and from residents in nursing homes. One that springs to mind last week was a picture of a resident in a nursing home holding up a sign, "We have loads of toilet roll." So again, I think we need to retain that sense of humour and ensure that despite the challenges that the residents, for many of them, it's still a daily life, and we need to ensure that they can continue to engage in activities and all of those things that are about the mental and I suppose social care side of the care, as well as the clinical side of care.
And so, I mean, there are those out there that are struggling with isolation. What are the mental health considerations we need to make as a community for staff working in nursing homes and those receiving care?
Yeah, well, it is important that people look after themselves. If you don't look after yourself, it's very difficult to look after others, obviously. So what we would say to people, yes, is make time for yourself in terms of mindfulness. Again, TV and radio and media generally is full of, I suppose, difficult news at this point in time. So we'd ask people to maybe limit their time on either mainstream media and indeed limit their time on social media and look after themselves.
And we have to speak about workforce. It's a big issue. I've noticed that Nursing Homes Ireland has a big recruitment drive on at the moment. Is this a call to arms?
Big time. I mean, the sector in the last number of years has struggled in terms of recruitment. We were, before the striking of COVID, in a full employment situation, and that was very challenging for the sector. But you're right, we have introduced our own recruitment drive. And similarly, the HSE launched their own recruitment drive. We were, I suppose, to say the least, a little bit annoyed initially when they were recruiting from our sector. And we have asked the Minister to desist from recruiting directly from frontline staff, because that is counterproductive. But yes, there is a campaign on at the moment called On Call for Ireland. And we've made that very point, that it is on call for Ireland. It's not on call for the the HSE are not on call for the hospitals, it's on call for Ireland. And that mirrors what we're doing ourselves, saying to people in the community who may have a yearning to work in the sector, or indeed who may have lost their job in the recent past, that they would consider coming and working in the nursing home sector, whether it is a carer, a nurse, maybe someone helping with cleaning in the kitchen. There's lots of opportunities, and they are, really, really rewarding careers working in nursing homes. To see the joy and the warmth of the people that you care for, it can be hugely uplifting and very, very rewarding.
Now, you've met with the Minister for Health and outlined the challenges facing the sector, and the department has announced measures to support residents in response to COVID-19. Can you run us through some of these?
Yeah, I suppose it is long overdue, unfortunately, because again, we did feel as a sector that there was a lack of prioritisation of the nursing home sector. When we launched our own visitor restrictions, there was some criticism of the sector. But now looking back, we're very proud of that decision that we made. So yes, in terms of the Minister, we had a very good engagement. I think it's fair to say that he understands the challenges we face, and it was very reassuring that he has committed to a series of measures. And I suppose they're twofold. There's the practical measures, and then there's also some financial measures. On the practical side, he has given a strong commitment that all staff would be prioritised for testing, because that's a huge issue. In many of our centres, we've staff out for 10, 12, 14 days in self-isolation, awaiting for testing or awaiting test results. So the prioritisation of testing is hugely important. The other area that he gave a commitment on was on the whole area of PPE, and we're talking obviously about PPE, but the other issue that we've come across recently is the whole area of oxygen and oxygen concentrators for residents. So again, he has said quite clearly that any discrimination on the basis of location or on the basis of service provider is not appropriate, and that he has committed that the HSE and government will step up to the plate on that. The final one, I suppose, is on the area of the financial package. And the Minister has announced a package of 72 million over a 3-month period to deal with the additionality of costs and the additionality of service that members are providing. In effect, members are providing hospital services now. Just yesterday, the Irish government announced there was 2,500 empty beds in the acute hospitals. So in effect, we would say that the nursing home sector is actually at the front line now and dealing with the surge of COVID residents within the setting and not necessarily being transferred to hospital. So in terms of the financial package, what the Minister has announced is that for every 40 residents in a nursing home, they would get an additional €800 per month per resident. For the next 40, it would be €400 per resident per month. And for any residents over that number, it will be €200 per resident per month. So again, that's an acknowledgement by the state of the significant costs associated. There's also a second tranche of potential funding if there's a significant outbreak of COVID in a nursing home, up to a maximum of €75,000 per month. So that is encouraging. We still haven't seen how that will operate in terms of the administration of the scheme, but it is very encouraging and very welcome at this point in time. But again, the other element of it is there'll be ongoing review, because obviously we're in uncharted territory. So over the next couple of months, we'll be engaging with the department and the Minister to ensure that all the packages that have been announced, both the practical and the financial, will be monitored, will be evaluated, and indeed enhanced as may be required.
And what about training and education?
Yes, absolutely. Again, our members would invest heavily on training and education on an ongoing basis. So now the government have said that they will make available, for example, HSE land and indeed resources from the state. There's also a skill nets, leading healthcare provider skill nets, and additional funding has been provided there for training. So it is vital that we continue to upskill the staff and support the staff to ensure that they can deliver the highest possible standard of care. This is I suppose an interesting time, a very challenging time, but it also gives us an opportunity to take some learning for the future to ensure that we are well prepared if this was ever to happen again. So the coming together and the collaboration between public, private and voluntary is something which we very much welcome. And hopefully there's a lot of learning from this as well that we can infuse in time into our daily operation as we move into the 2021 and beyond.
And what do you think? I mean, if you had advice for the nursing home sector as we work together to fight the threat moving forward towards recovery, what would that advice be? The best advice?
Well, I suppose at the moment I'm confident that we have the professional, caring, committed staff in the sector. So we just need to be supported to be able to do what we do best, which is look after older people. But I'd say to people, yes, to be resilient, maintain hope, obviously, and try and be strong. It is a very, very challenging time. There's no point in wilting under the pressure. Support each other is very important because, we all deal with crisis in different ways. It's important for us that we put our arms around each other in a metaphorical sense, obviously, given the challenges, to support each other as we deal with the challenges. So we're all in this together. It is a national effort now at this point in time, and we do need to take support from each other to be able to ensure that we can stave off the worst effects of what is a very, very significant and serious pandemic.
That's great advice. Tadhg Daly, thanks very much for joining us. We hope to see you again soon.
Absolutely, and thank you for the opportunity, and best wishes to you and yours.
Please keep up to date with the government information and remember to keep safe. I'm Steve Iliff. Join us next time on Altura Now.